This is the 40th year of this gathering and our very first virtual one. Like most things PTA, this is a collaboration. Thank you to our 3 PTA Council hosts, Las Trampas Creek, Pleasanton, and San Ramon Valley. I am Mercedes Badger from Pleasanton's PTA Council, tasked with introducing tonight's second of our 3 sessions. The Advocacy Day Planning Committee consisted of Nasser Mizrahi, Supita Castro, Heidi Ellicott Prisick, Lisa Gross, Robin Claw, Susanna Ordaway, Lynn Ashlee, Rachel Hurd, Velma Wilson, Amy Richard, and my colleague from Pleasanton, Kelvin Mayo. This group has dedicated time, energy, and months of meetings to organize our theme, moderators, and speakers. There's been quite a lot of juggling going on to volunteer. PTA folks, I know you understand. Oops. All right. Thank you to our elected officials, educators, and educational administrators who are in attendance. And thank you to our PTA members for taking time out of your busy schedules to be here. We selected the theme, moving forward with resiliency, because of the old adage, it's not whether you get knocked down, it's whether you get back up. Resiliency is defined as the capacity for a system to tolerate disturbances without collapsing, to withstand shocks, to rebuild itself when necessary, and to improve itself when possible. This is our theme, our call to action, and our discussion tonight. We have 2 interesting sessions ahead of us. We begin with what we are calling our health panel, followed by our equity panel. Please use the chat for technical support should you need any, and use the question and answer option to submit questions for the moderator's consideration. Finally, all our sessions are being recorded. Leading us tonight in our first conversation about health is Shayne Silva. Shayne is a longtime advocate for children. She is currently the health advocate on the PTA legislation team, but has served in various capacities for the California State PTA over the years, including as director of legislation. She has also served 18 years on her local school board. In addition to her PTA work, she presently participates in the court-appointed special advocate program in Contra Costa County and looks forward to the time with her CASA child. Shayne has been a proud member of PTA for over 30 years and a former 32nd district president. She is married with 2 adult children. Shayne, I'm passing it over to you. The floor is yours.
Thank you, Mercedes, and thank you for inviting me to come back to my home area and meet with all of your panelists tonight. I'm really pleased to be here, and I'm pleased to introduce Dr. Patrick Joseph, who is, as you can see from the screen, the chair of the infection control at San Ramon Regional Medical Center. He's also an associate clinical professor of medicine at UCSF and a past president of the National Foundation of Infectious Diseases. We also have Dr. Jeanne Noble, who's the director of COVID response at UCSF Medical Center in the emergency department. She also is an associate professor at UCSF. And our third panelist is Graham Wiseman. He is the co-founder of BeingWellCalifornia.org and a community advocate for mental health issues. That's close to my heart. I worked in patient psychiatry for 35 years. So thank you all panelists for coming and joining us. And thank you to the attendees. Our topic tonight is finding balance during the pandemic and beyond. And I would like to start with just having all of our panelists speak a few minutes about where they think we are today in terms of finding that balance. So Dr. Joseph, would you like to start off for us?
Oh, it would be a pleasure. And thank you very much, Shayne, for the lovely introduction. And thank you to all of the planners for this. Just listening to the time and energy that went into these sessions, I'm amazed. I do not want to cut into the time from the other panelists. They are the ones with the message for this audience. But I was asked to give a 2 or 3 minute overview of where we are and perhaps what's happened. And I want to tell you, I have decided during this, I am going to plagiarize your term resiliency, because the first thing that I wanted to say was just congratulations to all of us. And that means everybody listening and everybody who participated in this crazy changing time. And so I wrote this down. I just paraphrased it. Resiliency is the ability to tolerate disturbance without collapsing and rebuild when necessary. That is the best definition of the COVID pandemic in the United States that I have ever heard. So I'm going to take it from now on, and I'll send you royalties. The things that I want to say about this, and I'm going to give two examples that exemplify that resiliency. One is changing messages. It has been 15 months of changing messages, and that is perplexing to most people. But that's science. That's what we do. In fact, the more frequently we change the messaging, the better. When I was in training, we didn't change the management of simple pneumonia for years. It was the same year after year after year. But when we are changing messages, it's very simple. For something that's not understood, we get a consensus opinion and we invoke a practice. And then as we learn something, we change it. And that's what has been going on. And that's confusing to some people, but I think the more I talk to people, they understand that. So changing messaging is a good thing. It's progress. The other example of that is much more difficult to tolerate, and that is mixed messaging. That means on any given day, because we live in a free country, because we live in a free society, and because the internet is so widespread, one can hear two completely different recommendations from individuals who are apparently scholarly. And that's hard to digest. What is correct? What is totally off the wall? But we've gotten through it. And again, that's just an example of resiliency. The next thing I was asked to mention something is about vaccines and where we are. We just have to be proud of how quickly we have developed a vaccine, or many vaccines. We have 5 in the line right now. All are effective. All of them are far more effective than the flu vaccine, far more effective. And we've never had a vaccine other than perhaps hepatitis A that has been as good as the Pfizer and Moderna 2-dose vaccines. So we're looking really good at those vaccines. And we now have about 30% of the people in California and in the United States fully vaccinated and protected with a great deal of protective efficacy. So we're looking now for, and I'm going to use this term, this is not a molecular term, but this is a term I think most people understand, and that is resistant strains. We're looking very carefully at strains that might be resistant to the vaccines that we now have available. That's new for virus vaccines. We've never done that before. We never did it in the United States with a few exceptions, but United Kingdom did. And United Kingdom said, look, hey, we're finding some mutations that are stable mutations for which the vaccines may not work. So we have modified our entire scientific approach in the United States, not only in the state of California, a public health lab, but also the CDC labs where I'm involved. And we are looking very, very closely at mutations that may represent resistant strains. To date, none. The vaccines are not as effective against the 2-dose vaccines that we have in the United States, but the vaccine still works. So we're in a bit of this sweet spot, and we just have our fingers crossed that it's going to stay that way, but we're looking. And then the third thing I was asked to mention in my little brief overview here is what can we expect in the fall? And I'm going to defer most of that to others, but from a science perspective, I'll give you this. Within a couple of months, we will be vaccinating 12-year-olds. Looks very good. Advisory panel has already met. The FDA will expand the authorization to include 12-year-olds, but probably not less than 12-year-olds. In fact, we might not even see that by the fall when school opens. It's a much more difficult event to study because we do have to look more carefully at the kids developing anatomy and what the effects might be. So perhaps late fall, early 2022 at the latest. And what I can say as a substitute, and I'm not even sure we'll need this, but let me mention as my last comment, a substitute that will be available. Rapid testing will be inexpensive and readily available. So I'm not saying this will happen, but imagine it. Kids come to school, they line up, They get a swab that goes in an inch in their nose. It gets tested. In 15 minutes, you have an answer, and they move on into school knowing that they are not infectious. That is a very definite possibility if we need it. So again, congratulations to everybody. It has been a wild ride for 15 months, not like any other infectious disease that I've lived through in decades. And I can only be proud of all of the science and, more importantly, proud of the American public for resiliency. So thank you again for the invitation. I'm really looking forward to see what the speakers have to say tonight.
Thank you, Dr. Joseph. Dr. Noble.
Thank you for having me. I'm, going to dwell on the optimistic tone there for a moment. We are in a great place now, finally, a year into this pandemic here in California. We have the lowest community rates of COVID in the nation. The vast majority of our most vulnerable are vaccinated. Most of our teachers are vaccinated, and our oldest students, at least, have already started the vaccination process. So we're in a very good and different place now than we were a year ago, March. So in March of 2020, why did we close our schools? We closed our schools because we thought that children would be the primary drivers of the COVID pandemic. We thought they would suffer serious illness and death. We thought schools would be super spreaders. We thought closing schools would save tens of thousands of lives. And now we know that we were wrong. Kids pretty rarely get COVID. It's not that they're immune, but their numbers are really small. To put that in perspective of, more than 80,000 deaths in California from COVID, there's only been 16 deaths among people under the age of 18 since COVID began, which is the same number of kids who die from the flu every year. So it has not been, it didn't turn out to be an influenza-like disease. And in fact, it's important to recognize that mental health issues have always been a really important consideration for kids who are transitioning to different periods in their life, primarily the time of adolescence. So adolescents are about 14 times more likely to die of suicide than they are of COVID. And we have seen a real mental health crisis among our kids during the COVID pandemic. So in the emergency department in Children's Hospital of Oakland, we have seen a 66% increase in the number of kids coming in ages 10 to 17 with suicidal ideation, meaning they have recent or active thoughts of wanting to end their lives. We've seen about 130% increase in the number of kids who have been required hospitalization for eating disorders, and about a 75% increase in the number of kids brought in for mental health services who required immediate hospitalization. And those numbers are comparing 2019 to 2020. So kids have not weathered COVID particularly well, even though they haven't suffered a lot of physical illness from COVID infection per se. But continuing on the theme of resilience, so not to dwell on really sort of depressing statistics, but thinking, how do we move forward from this? Moving forward with resiliency and building resiliency in our kids does start first with recognition. So it's important to recognize that kids have been asked to sacrifice a lot in this very unusual time. As I referenced, when we first closed our schools, we thought that we would be really doing it to stem the spread of COVID. And then it turns out that kids are much less susceptible to COVID than adults. Yet their quarantine, their isolation has been longer than it has been for adults at all. So really recognizing what they've been through and even expecting that there might be, some resentment there, and showing appreciation and recognition that we know that they've struggled. And then reassurance that things are going to be okay. They are actually already on the road to getting much better, which is tremendous. Children tend to live much more in the moment than we do as adults. And it can feel like, I hear this all the time from kids who come into the emergency department that, they don't believe that things are ever going to get better because they've already forgotten how normal life is because it seems so long to them. And to remember that, and, and to really realize that kids do need a lot of reassurance that things are and will continue to get better, particularly by the fall. And then encouraging kids to really get out of the house and to socialize is incredibly important. And again, particularly adolescents, the mental health toll that we've seen is really for our middle schoolers and our high schoolers, which makes sense developmentally because younger children, although, Zoom education has been much harder for them to, I think, absorb and navigate, they're still primarily attached to their parents for approval and not seeking independence as much as middle schoolers and high schoolers are, who are really primed developmentally to be making those connections outside the home. So it's that age group where we've seen the greatest harm. And so putting aside to as much as we can the almost adult phobias we have of the realization of all of the illness from COVID, realizing that our numbers now are incredibly low and really showing a lot of confidence and reassurance that your kids can and should be getting out of the house. If their schools are open, reconnecting with their peers, reconnecting with their teachers, their coaches, their counselors. And then finally, having a really low threshold to seek mental health services if it seems at all needed, and being in really great touch with teachers. It's been a time of pretty severe social isolation for a lot of kids. And the quickest road to recovery is really putting them in touch with the support system that they need, those other trusted adults, getting them back out into a normal routine, exercising, socializing. That is exactly what they need. And they've sacrificed a lot. So building resiliency, I think those are the steps to get there. And it's great to be having this talk now when there's so much to look forward to, as opposed to back in December during the dark days of our surge.
Dr. Noble, before we go to Graham Wiseman, can you repeat, there was a question that they missed when the time frame for the 12 to 16-year-olds to might be able to get the vaccine. Could you?
Oh yeah, so the
Dr. Joseph, either of you.
The 12 to 16-year-olds, we are expecting that approval basically any day. So 12 to 15, the 16 and up are approved for the Pfizer. So that the submission was made on April 8th or April 9th, I believe. And we fully expect that the Pfizer vaccine will get the EUA, the emergency use authorization. And we expect it really any day in May. We think that will start happening soon. And then, as was mentioned, are under age 12, probably not until, December or so. They aren't even, fully finished enrolling in those trials.
Right. Well, Graham Wiseman, I suspect that you have something to say about where kids are mentally and emotionally right now. Would you like to go ahead and give us your feedback on that?
Yes, thank you. And I would really like to thank Dr. Joseph and Dr. Noble for really going over some of the facts and figures that are out there, and also giving that word of encouragement, because that's what we've been missing for so long, is really words of encouragement. Our entire country, all of us as a community, have gone through a traumatic event, and we're still, trying to emerge from it and figure out what's going on. And when I look at other traumatic events in history, like the bubonic plague that killed half the people in my home country, it's like, what happened to culture, society? How did the people emerge from that? And the answer is that they tried to get back to what was normal as quickly as they could. The effect on society was dealing with what you've experienced and moving on. The trouble is, young people don't have that perspective. They only have their short time span and what they've seen. And unfortunately, they pick this up and they look at their social trauma, which is what I call social media, because it can really affect the child. And they really don't have the filters that are going on. So as we think of school age kids, there's elementary, middle, and high school. Last week, I spoke at a middle school in Livermore, and I talked about, risky decisions that come up. And one of the things we talk about is mental health. At the end, we give a survey. So I spoke on a Tuesday, the team spoke on Thursday. So 2 days later, when we asked these students, what kind of stuck with you? A lot of them talked about the mental health component that they had heard on Tuesday. And 25% of these youth said, I've thought about suicide in the last 10 to 12 months. So I'm going to let that sink in. These are middle school that's looking out at a basketball team and knowing 2 of the kids on those teams are thinking about suicide. It is really, really a scary number. And I know this because I talk to students, I talk to parents, and I talk to many parents just after they've lost a child to suicide. And the reason I'm talking to those parents is I'm one of those parents. We lost our child, Colin, who's a 15-year-old sophomore at Aquilanes High School. We thought we were doing everything we could to help him with his depression, and it beat him. But buried 60 feet from Colin is another boy from Aquilanes, Jake. Jake's parents had no idea he was struggling with any mental health issues. In fact, they called him on the phone and he had just moved off to college. How are you doing? He said, I'm fine. He'd already put a letter in the mailbox, letting him know what he was going to do. And he did that the next morning. So I mention that because there is no easy answer. There is no, if they do this, then that. It is, each child is unique. Each person is unique. And when they struggle with these mental health issues, they're all going to kind of present in a different way. One of the things that's common is sleep. So when we think about our kids, when we think about what's going on with COVID, the trauma, getting back into school, all the things that as adults that we look at, one thing that's really important is we look at how much our kids are sleeping. So if they're only sleeping 5 or 6 hours a night, that's a warning sign. If they're sleeping 12 hours a day, that's a warning sign. If it continues for 2 weeks or longer, then you need professional help. And that's just kind of a guideline I give to all parents. But as we look at COVID and what's happened to us as a community, what we find is one of the greatest tragedies is our loss of trust. We don't trust the media. We don't trust doctors. We don't trust politicians. We don't trust teachers. We don't even trust our parents sometimes because of what's been going on for the past year or actually longer. So how can we help our kids get back? Well, what we need to do is really start working on building that trusted space, making school a place that they can trust when they go there, that they're not going to be manipulated or not given the full story. The kids really want to know what's going on. So finding that trusted space can be difficult. And I know with individuals who are struggling, a trusted adult is really critical for them. There's programs out there. There's one currently the California Department of Education is supporting, actually called a trusted space. And it's a program that helps teachers create that in a classroom in a 5-day period, trying to get kids to feel safe again. And that's really something that we're gonna have to work hard on, all of us, to get people to feel safe to say hello, safe to touch, safe to be within 10 feet of them, right? There is something came out of University of Colorado in the late 70s called Who You Are is Where You Were When. And what it does is it says that what's going on in your life when you're 10 years old will have long-term effects on how you view things. So if we use me as an example, when I was 10 years old, we had the Arab oil embargo. So a commodity like gasoline was not available. There was a little thing called Watergate that was going on. So what that did is that affected how I view politicians and government. United States was just withdrawing from Vietnam. So that questioned, what do we do? But it wasn't all bad. We also kind of got sick and tired of breathing beige air. So we founded the EPA, right? We started helping. So what we need to do as adults, what we need to do as parents is really focus on what we can set for our kids so that when they're 30 years old, they'll be comfortable talking with strangers. They'll be comfortable being near people. And we don't want that, what happens to them when they're 10, to be a detriment in their life.
So true. Thank you. I'm wondering if there are health issues, other kinds of health issues that have come up for kids since COVID that you have noticed happening.
So the most prominent one is just related to decreased physical activity. So we've seen spikes in obesity, actually fatty liver, which goes along with obesity, but definitely an uptick in that, and pre-diabetes and even diagnoses of diabetes. So the physical has been related primarily to lack of activity. Kids have become way more sedentary, which is not going to be a surprise to any of the parents during COVID, which is really not biologically natural at all. I mean, kids should be running around, and they have been seated like middle-aged adults. And then, in addition to the depression and suicidal ideation, we have seen a lot of social phobias really crop up, a lot of, severe anxiety as well, and fear of leaving the house, which increases the sort of sedentary nature that that not being in regular school has promoted.
It seems one of the things that we're seeing happen here is a greater awareness of how the physical and the mental issues are so intertwined. And I think that's one. I hesitate to call COVID having a silver lining, but I think it's made us more aware of the fact that these things are so very intertwined. And we talked a little bit about social interactions and the need to get back to that. Do you see that as being an ongoing kind of a problem for kids?
Yeah, I mean, I think that, weathering the pandemic was probably easier. I share Mr. Wiseman's feelings about social media causing a lot of harm to children. But it was, I think during this year of really pretty severe isolation, at least a little bit of a bridge to socialize with others, but not a substitute for real human interaction. And, and the hours are still greatly reduced too. So social interaction has been reduced qualitatively and quantitatively. And I think that, as schools reopen and kids are back out there in the public sphere and participating in sports, et cetera, a lot of this will, happen naturally with time, but really important to be on the lookout. I think that, the adults outside of the household and even within the household have a big role in making kids feel like it's okay to socialize, and not instilling fear that it is, this is dangerous, back up, don't get close to your friends. And, this fear of human interaction is real. I mean, we see that definitely among adults, and kids model a lot of what adults do. So I think having a real eye out to, inclusion, warmth, toning down, it's really time to tone down the fear. Even about physical distancing, our rates of COVID are incredibly low. Kids do not really need to back up from one another. So just shepherding them through that process.
And maybe Dr. Joseph, this might be a question more for you, but feel free anyone to jump in. Are we concerned about any variants that might be stronger or more hazardous in terms of COVID and infections?
Yeah, let me give a quick answer, and I don't want to, I mean, I'm just enjoying listening to Dr. Noble and Ms. Wiseman. So let me give you just a quick scientific answer. Yes, of course. We have an extremely sophisticated way of looking for mutations in virus. We just never planned on invoking it for so many COVID specimens. My labs are doing it and other laboratories are doing it. And we are looking for mutations that persist, and we know where to look for them. So looking for the mutations that are likely to do one of two things, either evade the effectiveness of the vaccine, comes up from a particular area of a gene, and mutations that are likely to be more contagious come from a different area of the spike gene. But we have no knowledge and no way to predict whether they will be more severe or less severe. A quick answer, this is learning in progress, but we have the methodology to look and follow.
Okay, great. Good to hear that. I'm wondering, when we talk about the things to look for in children in terms of their mental health, particularly in middle school and high school, Graham Wiseman, I believe that you were instrumental in setting something up at your son's high school. I wonder if you could talk about that a bit and how we might be able to use that in a broader sense.
Sure. After losing Colin, I was contacted by two other parents from the high school. I went to that high school. My wife went to the neighboring high school, so we definitely had a connection in the community. These two parents, one had a child with severe anxiety. She'd been out of school for 6 months. And the other had a child with leukemia. And so she'd been down at Children's Hospital in Oakland through most of her middle school time. So these two parents obviously had their fair share of interactions with school districts. We got together, we had a list of things we didn't like that was going on, and we came out from that and said, well, what are things we can actually positively impact? So we looked around at other schools that shared similar demographics. We went to Piedmont, we were in Marin County, we're down on the peninsula. If you live in this area, you're starting to pick up a theme here of the school districts that had one thing in common. They all had wellness centers. So we looked at what a wellness center actually was, because it's a very vague term. It could mean in San Francisco, it's a place to get your dental care, birth control. There's a lot of other stuff goes on in a wellness center, but we were focused on mental health. It took us 5 years, but we got the Alkalines Union High School District to fund on-campus wellness centers staffed with school district personnel and change their reentry program for when kids were out of school. In our district, 68% of the kids on home and hospital were there for anxiety. And the way that they were brought back into school was on Friday, you're in home and hospital, and Monday, you're back in school. And they went right back out, went right back out. So we were really pleased with that. And then that, of course, got the attention of San Ramon. So we started working with them for a couple of years. And we actually had a site visit. We brought the wellness team from San Ramon up to Alkalines High School. And at the end of that meeting, they said, we don't need to see anything else. We know exactly what we want, and we're going to put this in. So one of the things is, these wellness centers are effective. There's a lot of research on it. And I was really just so impressed that San Ramon said, we're going to put them on all campuses, K through 12. So we got the first two went in at Cal High and at Doherty, but then of course COVID happened. So everything's kind of stopped. But, people say, hey, that's great, Graham, but who can pay for these? So that led to us working on a campaign, which I believe you're familiar with, and is supported by California PTA to fund these wellness centers. And people say, well, Graham, why are you so fixated on wellness centers? A study came out of the University of Michigan in February of 2019. It was a 12-year study, and they took students who had either made suicide attempts or showed strong suicide ideation. One half of the group got the standard treatment. The other half of the group got the standard treatment, but with one difference. The youth selected a caring adult. That was the only difference. At the end of the 12-year study, the death rate was 660% lower in the group that had a trusted adult. We find those trusted adults at wellness centers. That's why I'm really pushing that we need these on campus. We need to build that trust back up. And imagine if we can reduce our death rate. I went on vacation in January. I came back and my phone was just on fire. We had 5 student deaths in Contra Costa and Solano County within a 1-week period, all suicides. At the death rate for COVID at that time in California for people under 18 was 0. So the mental health was what was killing them. And so people got very emotional and upset, but that wasn't the right direction to go in. The right direction is to look at what's going on and offer support. So, those wellness centers, remember, it was just 3 adults, just 3 parents, and we got that district to commit to $1 million to provide help for our kids. So this is the PTA, right? These are the people who can make this difference. And I hope I'm preaching to the choir here.
Actually, you're leading into my next question, which was going to be, yes, this is the advocacy conference. What kind of advocacy should the folks tuned in here engage in? I know from work that I've been doing in Sacramento, mental health has become there's 35 bills, I believe, right now that have to do with mental health in one form or another. I'm actually following 7 right now that we've taken support positions on, including your bill, SB 21. What kind of advocacy should parents be doing in order to help their children get through all of this? And that's a question for all of you. It's not, I think you all have different perspectives on that. So go for it.
Okay. So Senate Bill 21 is the mental health awareness license plate. So that is we ran a statewide competition. It was won by a student from Doherty Valley. So she's a senior there now, Anushri Banerjee, and it's a wonderful, wonderful design. If you go look at our website, you'll see it. It's beautiful. That license plate raises funds to go to the Department of Education. So we've had the pleasure of speaking one-on-one with Tony Thurmond, who's our state superintendent. And he's like, yeah, we need these wellness centers in here. We need funding. And he's like, I am your champion. I'm not even gonna have staff go and testify. I will. So he's really got a firm belief in improving it. There's actually 1,000 bills this year that have mental health somewhere in their language. So I do not envy you for trying to sort through them all, right? But for parents, hey, go to our, I'll just shamelessly plug it. Go to our website, beingwellca.org. You can see the license plate. You can sign up to support it. If we get 7,500 people to say, yeah, I'd like to get one, you don't have to pay anything. Then the governor is not going to be able to say, we don't want this. It'll really make a difference. Advocating going to a school district with a solution and not just to complain about a problem is really how we can advocate and make positive change in our students' lives.
And I would just add on, sort of the personal advocacy rather than the state level, which is so important and encouraging to hear about Tony Thurmond's support there, is, what we can all do as parents and interfacing with our schools is really encourage kids to get, if they have the option, if their school is open and their class is open, to really take that step. And really try to get them to go back to in-person schooling. And the more kids who do this, the more they're going to want to. I mean, there's been a lot of complaints of, only some kids come back. It's not their friends. It's awkward. It's strange. They're nervous. And then they say, forget it. We're just going to do Zoom. Realizing that is not a healthy option for kids. And just, we got to help them through this transition. And once kids are back, more kids come back. And that's a daily benefit for kids' mental health that we really need to promote now. And the more we can get sort of that path well grooved between now and the end of the school year, the better. And not really waiting till fall.
I think what you're saying is so true. I mean, I've heard stories about teenagers who over this past year, suddenly they have acne and they think they're the only person in the world that has acne. And they don't want to go to school because they have pimples all over their face, and they get to school and, oh, wait, everybody else has acne now too. Look what happened. And so I do see your point that kids can really distort things, and particularly adolescents go through so many physical changes during adolescence. And if they're not around their peers to see that everyone else is doing it, it can become very, very difficult for them to get back out there. So I'm wondering if any of you would like to predict what classrooms are going to look like in the fall when kids hopefully will be back in school and in a more traditional way, I guess is the best way to put it.
I'll just jump in with what I have heard coming down the pike from California Department of Public Health, that there will be no social distancing rules at all. And, as we know, we had a 6 foot or an absolute 4 foot mandated rule that then got dropped from a mandate to a 3 foot recommendation, but no social distancing recommendations at all, which will be really nice. We will have, we've been as adults and teachers most worried about our middle school and our high school kids. The majority of them hopefully will actually be vaccinated over the summer. So you have vaccinated teachers and vaccinated students. There's really no reason that middle school and high school shouldn't look much more like pre-COVID times than they have during COVID times. And then we know that elementary school kids have never, we know now that they're really not much of a risk. So I think school, hopefully, fingers crossed, is going to get off on the right foot, on time, full 5 days a week, and will really feel like normal school. And then the one issue, social distancing gone, there's not going to be any recommendations for these deep cleans, et cetera. We thought early on that COVID was, probably a fomite disease, could be spread from surfaces, and that sort of never really panned out. So, no Wednesday close downs for deep cleans, no social distancing or physical distancing. And then when do we get rid of our masks? And that's kind of $1 million question. And I don't know. Maybe Dr. Joseph will look in his crystal ball there. I have a lot of people saying by Thanksgiving, and maybe California, it's going to be earlier than that. Not sure.
Dr. Joseph, you're on.
I don't like to predict things. Let me give you the facts. The advisory committee, which is a different committee for immunization, but an advisory committee of the CDC came up with the guidelines to Dr. Walensky that were released last week or earlier this week about masking when it's not necessary. But here's the structure that many don't understand. The Centers for Disease Control and Prevention makes only recommendations. They have no legal authority whatsoever. They make recommendations based on consensus opinions of very, very brilliant people, and hence the recommendations of demasking. So if one is fully vaccinated, there's now very few places that a mask is even recommended. And that would be a large social event, a big crowd gathering, a concert, a sporting event. But in the United States, we have 64 state, tribal, and territorial governments, each of which has the authority to determine what guidelines to be used or followed. So California is one of those state governments. The recommendations are very clear, but it will be up to the current governor and all of the public health advisors to determine which, if any, of those guidelines will be followed. If we do not see resistance occur, then we will be demasking in a regular rate.
Okay. So I'm wondering, we've touched on this a little bit, but I'm wondering if you see any long-term social changes going on, particularly for kids because of COVID, as a result of COVID.
I'll just say on the resiliency theme, I don't think long-term social behaviors are really going to have changed. I think the question of how long it will take us and our children to fully recover, but I do think that they will go back to, really normal, robust, warm interactions with one another. And the question really to me is how quickly we can sort of normalize and get them there. And that maybe a silver lining here is, mental health issues for kids have been a neglected issue for a long time. I mean, we've in 2017 or 2018, I think there were 275 adolescent deaths by suicide in California, which is, when you talk about 16 deaths from influenza or COVID and 270 from suicide, that's a big deal. It's a major cause of death of kids. So taking this, we've seen a worsening of a crisis, but a crisis that already existed. So I do hope that we have raised awareness and that we don't just, shove that issue back under the rug as we normalize our social interactions and do more, like the wellness centers and the legislation to really make our kids healthier and even, better than before.
So I do have a question here from the audience. Dr. Noble, it's great that kids aren't dying from COVID and that they will be able to be vaccinated, but what about long-term side effects from COVID?
Yeah, so we're studying, we have a study at UCSF right now about, this colloquial referred to as long hauler syndrome. The initial data, I think, actually looks pretty optimistic. So some of the studies on the long hauler phenomenon of people having, persistent symptoms well after they've cleared the virus from their bodies have had some methodological problems. The two largest studies, actually half of the people approximately in each of those studies never had a positive COVID test and don't have antibodies. So it's a little bit questionable how prevalent this phenomenon is, which is, this is kind of normal in the ebb and flow of science. I mean, we see things happen and we want to investigate. I think that the number of kids affected by any kind of long hauler syndrome from COVID is incredibly small. So quantitatively, it's not a significant pediatric health risk. Fortunately, kids have just been very resilient when it comes to COVID, less likely to get infected, much less likely to get sick, and small numbers in terms of any longer lasting effects. And of the effects that we've seen, they seem to, dissipate with time. This is a new illness. We, of course, don't know the final trajectory, but a lot of viruses have caused, sequelae problems after the virus is cleared from the body that don't lead to lifelong issues. So I think good reason to be optimistic there.
Well, glad to hear it. Dr. Joseph, did you want to add anything to that?
No, that was, I think the question for tonight's audience is children, kids, pediatrics, and not my expertise. Adults clearly get more severely ill. They have a different illness. Long haulers is a real deal. But if we're talking about the long-term effects of a virus, we're also talking about a virus that's only been prevalent for about a year. So it's a little early to reach anything solid. Definitely, I have many patients who have unexplained symptoms that persist for 3 to 6 months. But it's too early to say if that's just going to go away in time. I will tell you scientifically, the cause for the persistent symptoms is unidentified, but certainly being investigated. So stay tuned.
Well, since we're talking about and beyond here, I was wondering, do we need to prepare for another pandemic? And do we have the tools? Do we need to be concerned about that and do something different? Or how would we prepare for that if you believe that that's coming?
Well, if it's to me, it's a quick answer. Absolutely. We were unprepared. We need to be prepared. And so that's a simple answer. It's easy. The difficulty is what is preparation and what is satisfactory preparation. And that's very hard because the next pandemic may not be a respiratory infection. It's unpredictable. A pandemic, by definition, is a worldwide epidemic. So I think what we have learned is the preparation needs to be flexible. It's not let's stockpile personal protective equipment because the next pandemic may not even be infectious. But let's be flexible as much as we can so that we can move quickly. So I do believe, yes, we do need to be prepared. And I think all of us who are listening tonight, the entire audience, should rest assured that this is not going without notice. It has both local, national, and international political attention that we don't want this to happen again.
Good to know. Good to know. It seems to me that one of the takeaways from this evening is that we really need to be paying attention to children's mental health, that we need to be aware of our kids and how they're feeling and noticing changes in their behavior. Anything else in that regard that we haven't talked about that you think it's important for our audience to know?
I think that, what we're dealing with on so much of this is perception. In my school district, 70% of the parents wanted their kids back at school. I know at Doherty, 17% wanted their. We're in the same community, we're the same kids, it's the same virus. So why is one community say 70%? Yeah, well, let's get back in school, and the other 17. It's a perception issue. So we really need to step right in front of that and help people understand. And I think Dr. Noble has really been extremely forceful on just giving, this is science, these are facts, and we need to remove opinion from it and move to what is really happening. I did see a comment in the chat regarding wellness centers, and that's a perception issue also. If you believe that somebody saying I need a break is an excuse, then you're really not addressing why somebody would say I need a break. As a child, stepping up and out of a class is a traumatic event because everybody's going to judge you. What's wrong with you? Where are you going? And so forth. So for a kid to have that inner strength to stand up and say, I'm going to go take a break, really is a great thing for them. The perception, though, of just a place to hide out and get some tea is it actually belongs in the 50s, quite honestly. We've evolved at school. Students come in, they're scanned. The professionals there know if they're a frequent flyer. They know if they're trying to get out of a math test. All these things are done to help get our kids back in. So we need them back in class. We need them back. Actually, I want to see a better normal. I don't want to go back to where we were because you know what? In San Ramon, I looked it up just before this. In San Ramon, the suicide ideation in the junior class was 22%. In the non-traditional school, those are the kids that are off on the other school, it's 40%. That is a breathtaking amount. And I go back to these numbers because the perception is it's not going to happen to me. Well, guess what? It happened to me. I thought I was doing everything possible. And unfortunately, I now know a whole secret club of parents, a club nobody ever wants to be in, that have lost their children to suicide. And we don't wear medals. You know why soldiers wear medals on the left side? That's to warn death that they're about to face a warrior. Our kids that aren't ready for that, right? When death comes, they're not ready. So we really need to take a step back about our perceptions about what it's like to be a kid, because being in school is nothing like it was when we were in school. And you throw a pandemic on top of that, you throw social unrest on top of that, you throw a political climate we're living in on top of that, and these poor kids, they really need our help. And it's up to us to help them, because like a table that's unstable, it can't fix itself. It needs one of us to kick a wedge under that leg and give them a stable platform to build their lives upon. So that's my ask, is that we take a look at our perceptions and check them and make sure that we're actually thinking of our kids.
All right. Anything else? Any last words?
I just want to second that. That's really beautifully stated. And I think that, anytime we've been through a big traumatic event like COVID, it's looking for ways to come out better and stronger. and not going back to the same old normal. And we have, COVID policies, this is not to undercut all of the, the astounding numbers of death and suffering associated with COVID disease. But at the same time, our COVID policies often have really hard ramifications. I mean, we've seen, skyrocketing rates of death from opioids and homelessness and all these things. And, people can't be with their loved ones inside the hospital. There's all sorts of downstream consequences from our attempts to do good, which are often entirely necessary. But in the spirit of we can always do better, learning from what we've, done over this past year. And hopefully, if another pandemic like this hits us in our lifetimes, we will do it better next time.
Thank you all very much for being here this evening, spending time with us. I really appreciate it. I hope that our audience enjoyed it very much. I found it very informative, and I want to thank you all.
That was
I would like to thank you, Shayne, just for giving me the opportunity to sit in and to listen to the brilliance firsthand. Dr. Noble and Mr. Wiseman, I've learned so much, and I just appreciate the time, the energy that both of you have put into our kids, understanding it, and then what we're doing tonight, and that is teaching. So it's been my honor to sit through this. Thank you very much for the invitation.
Thank you to all of you for joining us. Thank you, Shayne, for leading our discussion. That was reassuring and enlightening, eye-opening. Thank you for your knowledge, and thank you for sharing your time with us. As parents, we really needed to hear that conversation, and you complemented each other so well. All right, we're going to move on to our next panel. Thank you again.
Thank you.
Thank you.
Thank you, everyone.
Bye-bye.
All right, it's time for us to move on to our equity panel, and it's my pleasure to introduce our next moderator, Marilyn Lucey. Marilyn is the current California State PTA Diversity, Equity, and Inclusion Chair. Her understanding racial equity, partnering with your schools for special education advocacy, planning inclusive programs, and understanding culture and cultural bias workshops help develop PTA members, leaders, and partners. Her DEI work is informed by training through intercultural development inventory, race forward, courageous conversations, ACEs aware, and transformational leadership for sustainability. She is a member of the Government Alliance on Race Equity and one of their Racial Equity Here ambassadors. She is a former public school special education teacher, program director of a pediatric medical therapy and early intervention clinic, special education advocate, and a member of the Council of Parent Attorneys and Advocates for the Education of Disabled Students. Marilyn is a lifelong learner and continues her DEI professional development through the Othering and Belonging Institute at Berkeley and the Gender Spectrum Conference at St. Mary's. She's been a First Five commissioner since 2015 and is its current chair. She's an advisory board member to Help Me Grow and the Family Economic Security Partnership in Contra Costa County. She's a proud alumni of both San Ramon Valley Council of PTAs and the 32nd PTA District, having served as presidents for each. She lives in the Bay Area with her wonderful family and currently works as a deputy director for California State Assembly, covering education, health, mental health, and human services policy areas. Panel, welcome. You're in competent hands. I'm going to hand the floor to Marilyn.
Thank you so much. Hello, everybody. I am so happy to be here, but I am so honored to be moderating this panel. This is a group of mighty, mighty equity warriors, and they will not disappoint you. They have so much knowledge. Ashlee Gutierrez has more than 10 years of experience in public and charter schools. She's been an assistant principal and a teacher, and she has extensive experience in teacher professional development and curriculum design. And she is currently a doctoral student at UCSF studying human rights education and critical race theory. Felicia Mayo is the current Nike Chief Talent, Diversity, and Culture Officer and is responsible for leading the attraction, development, and retention of talent with a focus on systemic and sustained changes. She is a local parent. She lives locally with her husband and her kids. She loves nonprofit work and is an active member of Alpha Kappa Alpha sorority, the Rho Delta Omega chapter in Palo Alto. Griot B is a former assistant principal turned artist. His music and message has been heard all over our nation, more than 50 colleges. He is a griot, and in Western African tradition, a griot was charged with knowing the history of the kingdom. His company, Schoolyard Rap, educates learners of all ages about culturally responsive and culturally relevant pedagogy. Welcome, panel. Okay, let's make sure that you can, are you off mute?
Yes, it's been good to be here. Thank you for inviting us all out. It's good to see and be amongst a panel of such esteemed individuals. I feel lucky to be here. No, great.
Back at you, Brandon. Wonderful to meet all of you.
Likewise, likewise.
Great. So let's just warm up a little bit. Let's have a general question about equity. And this is to all of you. So we'll take you 1, 2, 3. The question is, what does equity mean to you, both personally and professionally? Why don't we start with Felicia?
Well, thank you, Marilyn, and to all of the parents here, thank you. And it's great to be here with all of you. So equity, what does that mean? Equity means personally, and I have the unique opportunity of having professional and personal intersect. I'm right now, I'm able to do some of my lifelong passionate work that I'm passionate about at a corporation, which is awesome. So, being authentic, my personal and professional is going to be the same, right? So equity is really about being fair. It is about fairness. And many folks get equity and equality, they use it interchangeably. And equality is about the same. And I think it's very important that as we talk about equity, that we start from the foundational definition and making sure that it is, in its simplest terms, it is having a level playing field for all. And, we have to look at people and make sure that the experiences that folks have, that we take that into consideration as we're looking at a level playing field. So that's really equity. And equity goes much deeper than as you're talking about equality. And so I'm sure we'll get into that a bit more, Marilyn. So that's what that means to me from a personal and professional perspective.
Thank you, Felicia. Why don't we go over to Ashlee next?
Hi, thank you so much for having me. I think Felicia covered a lot of the sentiments that I would share. I think, for me, equity is about, in my case, for students, the work that I do is in schools. Really, it's about students being fully seen and validated and affirmed for the complexity of all of their identities and all that they're bringing into school. It's about access and opportunity. It's about eliminating barriers and ensuring that everyone is not just getting the same thing, but everyone is getting the things that they need to be ultimately successful.
Okay, Griot, right over to you.
Okay, well, I think it's both well stated by both ladies. Honestly, I think if I'm going to boil it down, I think for me, equity is the step right before liberation, right? It's like it's a dual thing. It's of course, as Ms. Mayo said, it's of course, fairness, fair treatment, access, opportunity, and advancement for all people. But it's simultaneous work, and I at times in my experience with either school districts or just individuals, we miss the simultaneous aspect of equity, because it's that fairness and providing fairness for our students before our community, but also at the same time, it's working to identify and eliminate like barriers, right? That have prevented historically the full participation of those groups that we're now trying to work up. So that way there's not a need for those extra resources. And after a while, because we've eliminated those barriers for their students. And when it comes to professionally with equity, that's for me. And in personal life, I like to say that equity is a lifelong of learning. It's realizing deficiencies, realizing your personal deficiencies, whether it's in the household with my wife. Like I just, I'm a year in. We just had a year, and it's like, okay, how are we got a newborn now, 5 months, and like, how are we making this a very fair situation for both of us to balance? So it's not like this old school thinking, right, of men do this, women do this, but rather in this newer way of equity, it's like, how do we make sure that it is fair on both parts? And that's it's a constant strive of work for that fairness and understanding. So like I said, for me personally, I think it's more about learning and working towards it.
Great, thank you. Okay, so this one is for Felicia. It's the follow-up question for you. The title of this panel tonight is Building Competence for Equity. In your experience, why is it important for school districts to invest in building competence for equity in their students, their staff, and their community?
Well, first, I think first off, and just leveraging what Brandon and Ashlee have both stated is education, right? And that is what, your staff does and the district does, right? And making sure that they are training and educating the students with the up-to-date education, right? And so I think that also involves the staff continuously having education throughout their time, their period there, because you can never say, hey, 5 years ago or 10 years ago, I had some training and that's still, effective today. I would say right now, things are moving so quickly that in just the external landscape, things are shaping up differently every day that, if you say 6 months ago you had training, you're a bit outdated. Okay, so I think that as you think about the school district and the investment in in equity, you have to think about those foundational pieces, education. How do you educate your staff so that you can ensure that they are leveraging up-to-date tools and resources that they are placing on the students that they are teaching every day, and that they have a huge impact on, so that the students can then develop the competencies that are needed, so that when they're handed off to me, parents in corporations, like I am not starting from the beginning and trying to bring them up to speed of like, oh, wow, that's your thinking. And whoa, we need to sit down and we need to, go through a curriculum with you. I'd like for them to be there and I'm refreshing. I think the other part is, as you look at the community, you need events just like this, educational events where you bring in folks that are either working in diversity, equity, and inclusion, where you're hearing real life situations that you may be going through or you haven't thought about, and maybe is proactive, and you can kind of take all the different nuggets for in the future. I think it's very important that school districts focus in on, equity overall, because it will set a standard for the students, and it'll help with some values in our landscape that we have today. And you can never have too many values. And I think that in making sure too that the parents are involved. I think having very active parents in the PTA, as you can see, my husband is here. He's very active in the PTA, yay. And having the parents active in these type of educational opportunities is what will make the difference, because I do not believe that the school district should teach alone, but I also believe that they need to help to lead the way, because so often parents are leveraging tools that they were taught that may be off the mark. Because again, the way that the landscape externally is shaping up today in the world, not just in the US, we need our parents to have the correct tools because Gen Z and the millennials, they're thinking very differently, and they work different, they communicate different, they operate different. And if we're trying to use boomer style or Gen X style, it's never going to work. And we will not be able to have the open communications that will be very much so needed for in the future. So I really believe that, investing in this is very important from the district. So if you're not already doing it, please do it, because I need that connection of the pipeline of your students to university, if university is the choice, because it's not the only choice, and then into corporate, if they choose to come into corporate. We need to make sure that we are helping, the millennials and Gen Z through, and in some cases they can teach us, and we need to remain open.
Thank you, Felicia. So speaking of Gen Z, one of the buzz phrases that I hear constantly is decolonize the curriculum, right? It's on everybody's lips. All the Gen Z folks, they know. So Brandon, this is a question for you. You started as a history educator.
Yes.
Right? Decolonize the curriculum is a buzz phrase right now, but in conversational, person to person, parent to parent, educator to educator terms, what does that mean exactly? And what can that look like?
Yeah, that's a great question. I say in my chosen career right now, my company, Schoolyard Rap, and as an artist, hip hop artist, a rapper, a griot that educates, I say, in school we learn half truths or nothing about our past at all. We never learned we ruled the court. All we learned was basketball. But we were kings, queens, merchants, innovators, making things, doctors, lawyers, warriors. Every ist, we made every E. Astrology, geology, philosophy. We taught the Greeks, but see, all they ever teach our kids is slavery and Dr. King. When we talk about decolonizing the curriculum, it comes from an understanding and a truth that may be uncomfortable for many individuals who aren't necessarily of color, right? And that truth that we realize is that our education system, especially when it comes to history, is Eurocentric. It's a form of white supremacy. I know that might make people a little uncomfortable, but understand, I ain't blaming you here. I'm just saying the truth is that when you look at our history books, what we see, what we praise in our schools are white men, white Anglo-Saxon Protestant men, right? In a sense where everything that happened great in American history, with the exception of maybe, Dr. King, right, has been the byproduct of white men. Like if you think about it, we don't even learn about white women in school, in our history class. Maybe Amelia Earhart, maybe Bessie Ross, maybe Susan B. Anthony. But decolonizing the curriculum ultimately means it's accepting, firstly, that there is a huge scope of information that is not taught in our school system. It's secondly understanding that this huge scope that is omitted predominantly caters towards people of color and women in our schools. And third thing, taking steps to now include this information into our history curriculum, which there's companies out there like Schoolyard Rap who does that on a daily basis, who's geared and specializes in, but there's also simple ways teachers can just add something every single day into their only curriculum. Put images in history class of English class of Black authors or Latinx authors or Asian Pacific Islander authors, and then talk about that one day a week. Have Black Fact Friday, where every Friday you mention something or take 10 minutes to talk about Black facts, or Latinx Lesson Lunes and talk about Latinx history one day a week. So there's steps to take to decolonize the curriculum. But ultimately, we recognize that statistics and studies show that when students have a racial identity, a positive racial identity, right, it builds their self-esteem. Point blank, period. When people of color see themselves as great throughout history, when our ladies see themselves as great and throughout history, they have a positive self-esteem. And that turns into positive self-esteem. Statistics show that it lowers, right, suspension and detention rates, right? It increases graduation rates and test scores. It lowers recidivism rates. So really, if you're talking about from any political side, left or right, if you're talking about putting the best bang for our buck in our education system, right, then you have to focus on helping these students who are often omitted, always omitted from our education system when it comes to lessons of history, science, math, and start including them so that they have higher value in themselves, that they see themselves, and therefore lower a lot of the strains that are happening in the educational system by doing so. And that's decolonizing curriculum.
Thank you. Okay, Ashlee, I have a question for you. You and I spoke about San Ramon and other school districts that are similar, because you work for San Ramon and my students, my kids went to school in San Ramon. So in a school district or an area that has great affluence and families who have access to many opportunities, What is a blind spot that you've encountered in our parent community? What can be done about that, and why should we address it? This is for Ashlee.
One barrier that I come up against frequently is that when we start having conversations about equity and justice and liberation and decolonizing curriculum, the pushback that we often receive is that these conversations are political ones. And because that's politics, it doesn't have a place in our classroom. And so one of the things that I've been really actively working on is shifting that narrative to replace the idea that it's political and really zoom on humanity and humanization, and really talking about these issues as human rights issues. Because our students who are not performing at the level of their peers because they don't have access to curricular materials that honor their history, honor their racial identity, that they have teachers who don't understand their cultural competence in the ways that they're showing up in class, and their behaviors are perceived as adversarial or disrespectful. All of that results in these disproportionately negative outcomes for those students. And that is really rooted in a human rights issue that we need to address. So it's not really about, oh, you're this liberal with this wild left-wing agenda. It's actually coming back to that root of these definitions we said earlier about what equity even means. It's about access and opportunity. It's about eliminating barriers and really getting to a place of justice for all kids. So one of the ways that folks can really support these efforts is to start kind of pushing back on that narrative when you hear it. And, you know, this isn't about Trump or Biden. This is about all kids getting everything they need to be successful. And really, as a public school district, we have not only a moral obligation to deliver on that promise to students and families, but we have a legal obligation to do so too. There's legislation in the state of California that really compels us to put these narratives in front of students. SB 48, the FAIR Act, calls for diversity of representation across all of our curriculum. AB 1266 calls for students who identify as trans to be supported in being select bathrooms of their choice and play on sports teams of their choice. Like, we actually have this legislation in place to protect students and also to compel us into taking action on a lot of these things. So it really is our responsibility to lean into this work as a school district.
Thank you, Ashlee.
I'm sorry, can I just say one thing?
Yeah, absolutely. Go ahead.
On Ashlee, listen. I woke up this morning, I looked in the mirror. I'm Black. It ain't even February. Just imagine that, right? I'm Black for more than a month, every day, all year, right? Our students, they're their race every single day. It's very important. Like Ashlee just said, it's not a political thing, because no matter what, our students have to exist, right? They have to exist in this world. They're not inside like a cultural vacuum where they have to navigate this real world, right? Where they're racial and present, the way they look, it has real world ramifications, right? And so it's not a political thing, it's a reality thing. I just want to touch, and I agree wholehearted with you, and I really appreciate the fact you're making efforts to shift that narrative, which I think is a way to escape. A lot of people just to escape and wash away this issue that is something that is true to many people that don't necessarily look like them or believe in the political ideology that they do, which we have to do that as Americans. We have to get away from just this political thing and understand what's best for what matters most, and those are the kids, right? Because the kids matter. Sorry, had to just say something. I appreciate you, Ashlee. Thank you for the work you're doing.
Yes.
Thank you. Okay, so let's go back to a group question. This is for all of you. Equity, it has been recently, relatively, it's been something new, right? Before it used to be diversity and inclusion, and now it's diversity, equity, and inclusion. Are they the same? How does diversity and inclusion relate to equity?
So is it me?
Yeah, go ahead. Yeah.
Okay. So I would say, yes, you're right. It has shifted. Diversity is kind of like 101, right? It is representation, like who's here. So like if you in your school district and you are looking at your teachers, or if you're not looking at the numbers that you have, which is 101, that's your starting block, if you will. And you're not looking at the different races, the genders, the basic information. Sometimes it's ages. You want to make sure you have representation of the different generations, just like corporations do. If you're not looking at all of that, then that's the starting point. That's diversity. Inclusion is when you have passed the hurdle of representation And now you have like all of the variations and beautifulness of everyone there represented. And now you're going into like making sure that they feel like they belong. So that is where making sure that folks are included. It's not good enough just to bring in diversity and have them sit on the sidelines, or have them like, hey, let me just give you this and you just do that. And then like everyone else is over here doing other stuff, and you never like bring them in and include them through through whatever process you're going through, or your teaching or your methodology that you have. It's not good enough just to check the box. Inclusion, that's belonging. Equity, that's the hard work. I would say inclusion is hard for some. So equity is the hardest part. That's where you're looking for systemic solutions. Making sure, again, going back to the beginning of our conversation, of making sure that there's fairness there. Ensuring that your processes include absolutely everyone, and the systems you have developed or the systems you've had in play, you have investigated those to see what biases are present, where you get an external person to come in and review what you have to ensure that you don't have your biases, maybe in the administration, that are placed upon the students and your staff, where you really open up to show like, hey, this is the period of transparency. Equity is at that point where you say, and you're vulnerable, and you say, you know what? I don't know. I don't know. I don't. And so let's all get educated on it. It's okay to do that. And I think that so often, I believe like in corporate now, like we are held to a very high standard. I would say school districts and systems should be held just as high. And I'm not saying that just because I'm in corporate. I'm saying that because your children are my consumers. I'm saying that because your children are the future of this country or of the world. I'm saying that because all of us need to coexist, and we need to better understand each other. That is the only way that we're going to be able to continue to push boundaries in this country. And so I believe, like, as we look across the board, like diversity, inclusion, equity, you could actually see it a bit as linear, but in many cases, all of the three are happening all at once. They're all happening, but you got to make sure that you start with the basics of 101. That's diversity, representation. If you don't have the representation, the rest will not work. And so you really need to check yourselves on that, just like many corporations are doing right now. Just like, when you talk about government, Ashlee, and really looking at, like, now there are standards. There are a higher level of standards that are there. Like, there are so many elements of diversity and dimensions of diversity. You talk about abilities, you speak about LGBTQ+, there's so many different dimensions. And then I think in our area, we also have the dimension of being global, coming from another country and coming here and feeling included. So when you talk about like the inclusion piece, many folks stop there and they halfway do it. They don't get all the way into it. So really, they never reach that level of equity. So I would love for the administration and your staff to really think about that and pressure test yourselves and go outside of your boundaries. Because in most cases, like we're baby boomers or Gen X's, we actually place a lot of our ideals on the children, and Gen Xers and millennials, and I'm sorry, Gen Zs and millennials. So to that end, like, we're placing our thoughts and how we grew up on them, and they are very different. And we don't want to hold them back. So I think those three phrases are very different. You got to make sure you're taking a very focused approach and strategic approach. We use strategy for everything else. Why not use it for this? And why not make sure that we're placing our money and our bets on the future of our kids by ensuring that they have the most up-to-date education?
Thanks, Felicia. So Ashlee and Griot, if you have anything to add, she was very thorough, but if you have anything to add, is there anything that you'd like to add?
No, I just want to say in the history of the world, I don't think I've ever met a AK that did not want to go first. That's all I have to say in that situation.
That is correct. That is correct. And for those that do not know, our Vice President, Kamala Harris, Vice President Kamala Harris is a member of Alpha Kappa Alpha Sorority Incorporated. So that is your history lesson for today.
My mom likes to remind me.
Okay, so let's move on then. So talking about, diversity, representation, Brandon, I've been to one of your rap concerts. It's really fun. I think that's one of the greatest things, is that there is representation of people who look like the kids in learning those lessons. So when kids have fun and they learn new things, they always take it home, right? They talk to parents about it. So I know that you have programs for kids, but what can parents do to support their own development of knowledge around diversity, equity, and inclusion?
Yeah, that's a great question, and thank you for coming to the concert. That's great to it. Yeah, no, Schoolyard Rap, my company, we provide contents around the subject matters of Black history, Latinx history, U.S. history, world history, for school districts, cities, and corporations. So parents are learners too. Like, what happens? We forget that 8 hours a day students are at school, 7 to 8, depending on what district. The rest of the time they're at home, theoretically, right? And I believe there's many resources for parents. It's about the desire to want to learn more than anything, right? For instance, my albums, right? The modality in which I use is music. There are videos on YouTube, right, where you can go to like Crash Course World History if you just want to learn a little bit world history, right, on YouTube. For my company, Schoolyard Rap, we have entire albums. Black history album called Our Story, the Latinx history album called Historia, U.S. history album called U.S. History Volume 1. And so these resources, if you just want to plug and play and listen, those are ways to do it. There's podcasts for parents to know. It's very essential that parents actually continue their education as well. Hate or racism isn't born, it's taught, right? And I think, one thing I've always said is, growing up, they always said I was going to be a preacher, right? Because my daddy was a preacher, and I grew up in church, and I had, that's Preacher Brown. But, I don't go around preaching the gospel of Jesus Christ. I say that for my church and my household. What I do, though, as I've, traveled to 19 states and performed at 170 schools, is I preach this message of love, right? Love of thy neighbor, love of yourself for students of color, right? And that message is important for everyone. And I think those students leave classroom, they're still taught by their first teachers, and their first teachers are parents, right? And so our parents also need to take steps to learn a little bit more, if you so desire, right? You have to desire to want to make that change or to learn more. But I think Ashlee hit the nail on the head. It's about constant learning and growth when it comes to that for our parents. So I tell you this, there was a real big situation over the past 2020. Obviously, we know, with George Floyd being murdered, with Breonna Taylor, with Ahmaud Arbery. And so what I did during that time at home, I was like, how do I really steer this conversation in a positive way? Because there was a lot from different sides, and people were asking me questions. My friends, white friends, Black friends, are asking me, like, why is this happening? What's going on? And so I created an album called Racism, right? Racism. And it teaches about the history of systemic marginalization and oppression in America towards African Americans. We have a song called Setup, which teaches about the prison pipeline system, and that's currently on the Billboard charts. So educational song, Billboard charts, go figure, like number 36 too. Okay. The point is, I say, and call this a shameless plug, but I think that's a phenomenal resource for parents to want to learn a little bit more about what it feels like in this country to be African American through a historical lens of things that have occurred. That's a great resource. And so ultimately, I think parents need to, if they so desire, listen to podcasts, watch documentaries, listen to Griot B on Schoolyard Rap, and learn a little bit more about people of color and the existence of other individuals that don't necessarily look like yourself, because that's really how you understand and build community, is going out of your way to go talk to that neighbor, who doesn't look like you, to get to know about his personality and his culture besides what you were just taught in your isolated way. The best thing for me is going to college, and that's the really first time I met like a lot of white folks, like for real. And I spent time and I listened to rock, and I learned about all these different music music genres. And one of my roommates, Sergey, he was, was Jewish. So we, on Friday, we put the, we passed the cup around and did the prayers. And my homie, what Lewis was Brazilian. And so what I'm saying is that was a time where I was forced to meet people of different cultures. And in doing so, I found there a lot of profound respect for those individuals and those cultures that they came from. And I think as adults, we have to be lifelong learners to continue going out of our comfort zone to try to learn more than what we're taught or grew up with in our isolated bubbles.
Thank you. All right, so staying on with diversity and inclusion. This is a question for Ashlee. You and I spoke about diversity and how sometimes ability diversity is left out of those conversations. What can educators, schools, school districts do to better center the disabled community in efforts to be more equitable for all students, including invisible disabilities?
Sure. I think, many of our special education programs are really designed to be exclusionary, right? We pull out a group of students into this separate space and they become really invisible to peers and the rest of the school community. And in some situations, there are students who have, significant needs and they need a different space. And in a lot of environments, actually those students could be included with their general ed peers with the appropriate supports and accommodations. And so I think one of the first things is to look for opportunities to insist upon inclusion for all of our students and to make sure that students are getting what they need in a traditional classroom setting. I think it's also important to understand kind of the intersection of these issues, right? It's not just about race and about ability. There is a disproportionate representation of students of color in special education, specifically our Black students and specifically our Black boys, right? And so we have to sort of interrogate some of the reasons why that is and look at some of our practices that are not humanizing for those students, not valuing their contributions, that are misinterpreting behaviors or not doing enough to make them adequately successful in those environments. And so they kind of tracked to these alternative spaces. So I think we need to be really critically self-reflective about the process and the pathway that takes a student from a general ed classroom into a special education classroom. And then for those students who really do need the supports and services of special education, we need to look at how those general education staff and special education staff can be working together to provide wraparound supports for those students so that they're getting equal access to opportunity and experiences during their whole classroom journey.
Okay, the next question is for Felicia. Felicia, when you and I spoke, you mentioned diversity of thought, and that really piqued my interest. So what is diversity of thought and why is it important for innovation?
Yeah, so I would say, as we spoke, Marilyn, diversity of thought can't happen unless you have diversity, right? It's the diversity 101. You got to have the differences sitting at the table. And it's also differences or diversity you can see and the diversity you can't see. It's the experiences as well. And perspective and diversity of perspective and thought is what fuels innovation. Like I've been in tech for over 20 years, right? And now at a consumer goods company, and diversity is the one constant between those two industries, is to ensure that you have that innovation that is sparked from experiences where sitting at the table, everyone has a voice, everyone is seen, everyone is heard. That is where you create some of the most amazing product, the most amazing opportunities happen out of those debates. Many times they're very spirited debates, and everyone sees and hears everyone. And so the thought of the diversity of thought equates innovation. It is real. And you can have a diverse group of individuals that you can see. So you can have every race. I'm going to go to race because everyone can see that. You go to race, you can actually have, difference of genders and different races sitting there. But if all of us attended Stanford University, our experiences from Stanford, our methodologies are going to be very aligned. They're going to be very much alike. However, if I got Stanford, I got Duke, I got someone that if I'm in tech, they just learned and picked up, the trade of and the learning on their own and just have loved it and didn't go to college. They went to community. We got someone from community college. We got someone else that, has come from a different country. That beauty of perspective sitting at the table is what causes you to innovate. And it should be no different for schools. It should be no different. Allowing everyone to be heard, allowing everyone to put their idea out there. There is no bad idea. And I think to Ashlee's point, just making sure that, we're challenging some of the status quo. Like, why is it that, I won't single out anyone, but why isn't that one person not sitting at the table with everyone else? Maybe they had a hard day. Maybe they have, have some family concerns or issues. Like, we're always thinking about that, giving everyone the benefit of the doubt. I think, just innovation in my space is key. And I think that, in our area, in our district, many of our parents are in tech and just in being in Northern California. And I think that, you want to really focus in on and be very present. As you are at work, be just as present at home as you're hearing your children talk about their experiences in the classroom, their experiences with other, schoolmates. How is that going? When you start hearing that they have the same friends that look just like them, they don't have any differences there. I would challenge you to say, is there a difference of perspectives here? Is my child being exposed to being able to think outside of boundaries and being able to innovate? So perspectives, difference of perspectives and experiences are key in innovation, as we discussed, Marilyn.
Great, thank you. Okay, I think we have about 20 minutes left. I do have questions for you, but let's take a question from our chat, one of our questions here. Let's see. I'm going to ask Heidi. Heidi, could you help me find that really good question? I saw it scrolling by.
If you go to the Q&A button, you should be able to, you'll see there's a one. Do you see that?
Aha, I have it. Yes,
Yep.
thank you.
Okay.
Thank you.
My pleasure.
Okay, this is from Meg Richardson. As the mom of an autistic daughter, I worry that instead of including special education students in programs like extracurriculars and athletics where they can develop friendships, the general education leadership students are encouraged to stage performative events. How do we move toward inclusion in the life of a school, especially when students are not attending their home school in the district?
I think Felicia brought up some points earlier that really relate to this, right? That inclusion, having the diversity of voice at the table who's making decisions and pointing out things that we're overlooking. If everyone at the school system grew up in general education and only has that lens, they're going to make decisions from that standpoint where they're thinking about the experiences of students in general education. But if we have, students on leadership who are involved in special education, this is their lens, right? And they're thinking, how do we make sure everyone is included? So I think it starts with that diversity of representation and inclusion of voice to illuminate these blind spots for us and point out biases or things that we're overlooking. But that doesn't absolve us of responsibility, right? We can't just invite these folks to the table and have them do the work for us. So it's both making sure we have more folks at the table who are pointing out these gaps in our thinking and continuing to interrogate our practice. And the Equity Literacy Institute, which is one of my favorite resources, have some really simple reflection questions for this, like, who is marginalized, who is benefiting, whose voice is missing, right? Those are just some very basic questions we can be asking ourselves whenever we're putting together community events or thinking about putting out flyers about different sporting events or different clubs or opportunities for students. Like, where are we posting those? Have we made sure we've gotten to every class? Have we hit every teacher, gen ed and special ed? And then for students that are not at their home school, always making sure that we're reaching out to any alternative placements to make sure that they're included as well.
Thank you, Ashlee. Okay, so I'm just gonna, oh, go ahead. Did
I
you
was
want to say something for you?
Yeah, I mean, Meg, I former assistant principal, and one thing I appreciated, by the way, in Richmond, California, I appreciated and learned very soon the power of the parent voice, the power of that parent email. A casual conversation is one thing, but you get that parent email saying, hey, I would like my daughter to participate in this or this. The law states that they should. Can you please make sure you offer up opportunities for her to do so? At that moment, when it's written down, it's law. It's living proof. Now, I tell my students the same thing, especially our students of color. I'm like, typically, like in the, certain communities are word, more of an oral tradition, especially in the African American community. But in this American tradition, right, it's what is written becomes pretty much proof. And so I advocate for you, Meg, to send an email, ask, right? Ask and / demand that this happens. Ask for these meetings. See, one thing I always tell people is that this is America and our country, the way our country built is, our taxpayers pay dollars to governments. The government programs, in turn, are there to support and provide services for those taxpayers. Therefore, just like our elected officials, they are actually at the whim of the voters, us. It's the same thing for our teachers, our principals, right? Our students and parents are the ones with the true power. In fact, every school should be serving the students and parents. That's their job. Your tax dollars, your property tax dollars, pays for the salaries of our teachers and principals. Therefore, advocate for what you in the community think is right and what you believe. And that in this situation where there are laws that protect you and actually enforce certain things, I don't care if people think it's right or wrong. The law is the law. Until the law changes, you have the opportunity to take advantage of that law. So therefore, send an email, ask, make sure you get it on paper, and then make sure you have a meeting, follow up. And if that doesn't work, go to the next level above. But I guarantee you, if you're in the right, then it should happen. Not just morally, but legally. So.
Thank you. Okay, so staying on this idea of different perspectives, innovation, Ashlee, this is a question for you. I know that in your history, you have been a school leader of a charter school system. And can you tell us about why you developed that charter school system and a little bit more about the mission that drove you to start a different opportunity?
Yes, that school was also in Richmond. Shout out to the rich. And, we were really focused on building a school community that gave every student what they needed and that saw our responsibility not just to academic outcomes, but to social emotional outcomes, to civic engagement outcomes. And so we founded the charter school on 4 pillars of heart, smart, think, and act. So heart was really focused on social emotional well-being, interpersonal connection. We had time in the day that was dedicated towards just being with each other, just engaging in like joyful play and sitting with each other and learning each other and actively building community. SMART was really focused on the scope of our curricular offerings and decolonizing the curriculum that we were using. We had a lot of materials that were created by teachers because we know that a lot of the flaw in this sort of packaged curriculum that you buy off the shelf is the people writing that curriculum are mostly white, mostly men, right? And so the narratives that they're telling are very limited. But when you have a diverse staff who is infusing their own lived experience into the curriculum and really kind of building this out of the service of love for kids, these learning experiences are just really rich and dynamic. And then Think was really focused on critical thinking, problem solving, tinkering. So our students as young as kindergarten were engaged in coding and robotics and engineering and just really kind of experiencing this hands-on learning environment that's just not common. We had a maker space and kids were just doing really cool stuff and building things that I was like, I don't even know what this is. I don't know how to do this. This is awesome. And then it sort of culminated with this idea of ACT that, people say that the school system is not political, but we know that the roots of formalized schooling were to prepare an informed electorate, right? A democracy only works with citizens who are engaged diplomatically. And so students know that they have a voice, that they can use their voice. And so we had students that were organizing protests and walkouts and all kinds of stuff all the time, just really kind of tapping into that and finding their voice and finding their passions. And, you know, we really tried to set them up with the resources, but then let them make their decisions about the causes that were important to them and the things that they wanted to go advocate for. So all 4 of those pieces kind of came together in this really magical little space that was an interesting cross section of identities and socioeconomic status and documentation status and language. And it was a really beautiful community that's still operating as a TK through 8 today.
Wonderful. Okay, the next question is for Brandon. I'm going to stay on that that track of what's missing, right? And thinking of new things to fill that spot. Part of what you started, Brandon, is you didn't see the curriculum in a fun way for Black and Brown students. And so you said, I'm going to create something like that. And I saw how excited the kids were. But what I saw in your concert is that there weren't really songs for other groups of students, like API students or LGBTQ students or anything like that. Is that something that you're thinking of developing?
Yeah, that's a great question. Yes, you saw a phenomenal performance of students who are engaged. The school itself, they asked me to, it wasn't just a Black history, we mixed some of our Latinx, our Latino history content in it as well. So it's kind of a multicultural diversity because the school itself wanted to present this idea that they were growing a garden and working with a community. So we used some of their pillars. And so there wasn't any Asian or Pacific Islander or any of that content in there. And to be completely transparent, I don't have any yet. You know, when it comes about equity, right? We talk, this whole thing's about equity. When I look at equity, I look at statistics. The number one suspended individual groups are African-Americans, right? African-American boys, African-American females. Latinx and Latinos are second, right? And so when I came to try to disrupt this system, and to provide content to celebrate, to educate those students and their teachers. Because I want to say this, I think it's just as important for white individuals to learn from my music as other people. Like I said before, hate is and ignorance and racism racism is taught, right? And I think what leads to it more than anything is ignorance. And that's what I do as a griot. I travel around and I provide truth to eradicate ignorance, right? And so I do not yet have Asian Pacific Islander content. I do not yet have LGBTQ content, but I will. In fact, our company is, we just recently got a lot of funding. So, you know, through some investors, through some contracts coming in, like the Thomas Unified School District just committed a bunch of money, $100K to it. So we're developing this entire curriculum that is ethnic studies centered. And how I want to do it is not necessarily as it is in its current form. I have a Black history album, Latino album, but what we're going to do is the curriculum is not just by race, right? Instead, it's by themes. So let's talk about pre-colonization in these countries. Bam, theme 1, month 1. Theme 2, let's talk about, you know, STEM in these different cultures, right? And so that way we're not isolating by just race, but rather we're learning by different topic to kind of understand and bring home that whole idea that, you know, everybody has contributed to the fabric of the country. So the short answer to that beautiful question is I yet to have it because that isn't my expertise. You know, my degree was in African American studies and ethnic studies, right? And so I have experience learning about Black history and Chicano studies, right? But I've yet to learn all the history about Asian Pacific Islander enough to write an album. But trust and believe that is on the way. We're gonna get that because we want to make a full-fledged, fully developed curriculum for the state. My hope is that when they think curriculum, they don't think McGraw-Hill, they think schoolyard rap. They don't think Mifflin, they think schoolyard rap. That's where I want to get at. And so, yeah, we're going to be working on that, especially now that we got some good funding coming in. So, yeah.
Wonderful. Thank you. Okay, so the next question is going to be for Felicia. I really enjoyed our conversation, last week, and it really had me thinking about how many times I'm in a space where I am the lone voice. You know, I'm in a lot of white spaces. That it just happens that way because of where we live. And I thought, for you, Felicia, what does it feel like to be in our community, which is primarily white, affluent, tends to be more homogenous than other areas in the Bay Area? What is it like to be a Black mom in a school system or district here in this area?
Well, I will tell you, I'm originally from, and I think Marilyn, we talked about this. I'm originally from the East Coast, so very different makeup from North Carolina at the South, very different makeup than Pleasanton, California. Okay, so, and for me, it was quite different. Now I've been here for about 20 years. And so, I've become one with it and have tried to make an impact in the community as much as I possibly can, right? And making sure that I am always present in different school board meetings. I'm active, or my husband is active in much of the work that we, see happening, being very close to the school system and making sure that we can see, not only hear from our kids, but we can see it for ourselves. My kids actually go to a high school where, there's a high number, there are about 1,300 students, and you can probably count on one hand all the Black students. And so I've asked, them very directly, like, how does that feel for you? Now, for them, they are from California. So that's why I asked the question, because I never want to place how I came up, what my experience was on them. And so understanding, like, they've always been in this situation, so they're like, oh yeah, I'm kind of the only one. And I'm gonna hit on something that Brandon said earlier, which is, please don't just, my kids were like, Mom, every time is February, why, when we talk about slaves, everyone looks at me and asks me to answer the question. Like, while I can answer the question, like, that is not cool. In their words, that's not cool. Why would they do that? And so I think for them, it's isolating. And they have found their voice, which is wonderful. They know their history. They have the unique opportunity of having a mom that has been doing diversity, equity, and inclusion for years here in the Bay Area at corporations, as well as now at Nike. And so they understand, and they can probably tell you about microaggressions. They could, that was like, what was that? I know exactly what that was. But I have to tell you, in the last year, with them being home and, their parents, me and my husband being home as well, we found that we're having very, thoughtful conversations. I would say in the last 4 years, they are now of age where we can have those conversations to say, well, how did that make you feel? When you saw that, or when your friend said that, how did that make you feel? How did you address it? What did you say? So I would say, as a Black parent, specifically here, like, literally, I know all the Black parents. Like, that's number one. I'm like, hey, okay, you're new. How are you? I'm Felicia. Tell me your name, or anyone that is of color, a person of color, because I want to get to know them, because I want to connect with them and make sure that the isolation is not there for my children. Now, that's not to say that they don't have, very diverse friends, and they do. They have, my daughter plays soccer. So she has, there's rarely any Black girls that play soccer with her. So again, she has learned how to operate in this community. But most importantly, it's not about surviving and operating for me. Most importantly, she knows who she is. I know who she is. We have those open conversations, and she is so ready and prepared for the future. And she knows she's beautiful in her skin, and my son is as well. They will go and have a discussion with absolutely anyone about diversity and making sure that equity is highlighted. So as a Black mom, isolating, but we have created a norm for us. We've also made sure that those around us understand what we stand for, what our values are, and that we will not shift our values overall. And we live those values absolutely every day. So I will tell you, Marilyn, like, it is a struggle. It is a struggle as a Black mom, but we have definitely, stayed close to the schools, had those conversations. So Meg, we've always stayed close to the principals, to the teachers. If I felt like my daughter or son was getting stereotyped in some way, we brought all the teachers in. Let's have a group conversation, because we need to all sit at the table. And my question is always, how are you going to make sure my child is successful? Because your job is to make them successful. So absolutely, I think partner with all of the leaders in your community to ensure that your voice is being heard. Thank you.
Thank you. Okay, we have about 4 minutes left, so 1 minute each of you. What one thing, one message, one action can you leave with our parents that are in our community that's here tonight? Why don't we start with Felicia, if you're ready to go, let's start with you.
Absolutely. Stay up on your game. Stay educated. If you're not educated, start. Because the world is only gonna go faster.
Okay, let's move to Ashlee.
Stay educated so you can have these conversations with your kids because they're ready. Our kids are so much more capable than we give them credit for. We often feel like we need to be really prepared and well-researched before we can engage in a conversation. But when you can model learning orientation, when you can model that vulnerability of not knowing the answer, that actually pushes the conversation to even deeper levels. So have those conversations with your kids because they're ready.
I'm gonna say stay educated, right? Stay ready so that you can have these conversations with your kids because you're ready by listening to my music. I put in the chat real quick for y'all. It help you out. There's shameless plug there. Trust me, it's really good. Y'all enjoy that. No, but more than anything, I want to say that everyone has a different story. Everyone has a different experience. And people who are explaining their experience, even though you don't agree with it or understand it, doesn't make their experience less real. Empathy is essential for equity and change. Have empathy, develop that empathy muscle so that you can truly try to put yourself into people's shoes. I didn't understand all this LGBTQ stuff. I grew up in the church until my brother turned into a sister. And then now I got a sister. So I have to understand that because that's family. Change is incumbent upon everyone. That happens in this country, in this world. Change is always going to happen. And if you don't understand or try to understand the changes that are happening, even if you don't agree with them, you're going to be missing out and you're going to be left in the dust, like Ashlee said.
All right, I know we said that was the last question, but there's such a good question in the chat. Just one final question for anyone and everyone. So we have a question that says, it sometimes seems like only the loudest or the strongest voices are heard. What strategies can you recommend that would support our silenced voices to feel empowered to speak up?
I think it's so important to remember that those voices that are silenced or don't feel like they can speak up, they're often the people who were advocating and coming up against, hitting that wall over and over. And so often they're feeling disenfranchised, and their lack of speaking up is really about self-preservation because they've just been so burned. And so I think it's really important that as we continue to educate ourselves and we become allies in this work and in this fight, that we use our voices so that we create those pathways and we're kind of all agitating for this change together so that we aren't dependent on only those voices. Only the LGBTQ parents are at the district office demanding change, right? We all need to be up in that district office demanding change on behalf of all of our kids, because inclusion practices for that group is also great for our kids, even if they're not a part of that group. So it's incumbent upon all of us to speak up about what's right and what's true. And then hopefully that creates a space and the condition through which other folks can bring their voice into that conversation and do so in a way that they know that they'll be kind of heard and seen and validated as they do it.
I don't really think I need to add on anything other than sometimes if you know about sports, sometimes you have to give students a win, right? You got to give them a little small win. A way to do that is to talk to their coach. Their coach is their teacher, right? Hey, call on my child for this question this week, right? Hey, can you pose this question for my son this week? I'm really working on his self-esteem or building his ability to speak out. And that small win can snowball and lead to more, right? That's my suggestion on top of everything that Ashlee just said, which was phenomenal. That's what that doctorate gets you. I got to get there.
I agree. I agree with Ashlee and Brandon here. And I think, someone put it in the chat, allies, making sure what Brandon is highlighting is making sure you have allies there that sometimes can speak on your behalf. And typically that can get you to a point that you'd like to get to, and probably in some cases can get you there faster. But I think that don't always equate the loud voices with the voices that are right. Don't always equate it that way, and never let those loud voices silence you, and help your children understand that, because just because you're loud doesn't mean that you're saying the right thing, you're doing the right thing for everyone. And there are some loud voices, so I do hear you. And sometimes you can be loud and wrong.
Wow. Thank you, panel. Thanks for taking us to school and educating us. Thanks, Marilyn, for leading the discussion. It was wonderful. Thanks to all of you for your time. We couldn't have planned a advocacy day without a discussion on equity, especially in the year we've just come through. And we certainly have work to do, but PTA folks know about work, and all children are our children. So again, thank you for your time. We are done for tonight. I hope you enjoyed these two really interesting sessions. Please return tomorrow morning at 9 a.m. for our final discussion and the event we've been building up to, the chance to advocate directly to our legislators. Good night.